Thank you. So the great pediatrician Belichick said that the pediatrician has three important clients: first the child, second the child, and third the child. And I think that's going to be the main point of my talk, that yes, we need to respect diversity, and yes, we need to try to accommodate, and yes, we need to be tolerant, but ultimately our patient is the patient, as others have said, and parents and others are here to help us take care of the patient, and when they're trying to lead us in a course that's not in the interest of the patient, we need to remember who the patient is. The American Academy of Pediatrics in 2013 said pediatricians should respect families and their religious or spiritual beliefs, and in the same document said pediatricians should report suspected cases of medical neglect to state child protective service agencies, regardless of whether the parent's decision is based on religious beliefs. And moreover, pediatricians should work to repeal religious exemptions to child abuse and neglect laws. So how can those three statements be true, that we're supposed to respect families, but when we disagree with them, we're going to call the cops and we're going to try to get rid of laws that lend support to their views that disagree with our own? So my task in the next 25 minutes or so is to try to say how I think all those things can be true, how we can respect families, but that doesn't necessarily mean to agree with them or to act in the way that they want us to act. I'll try to make 5 points. First, that while diversity is a desirable goal in many spheres of life, and I'll mention some of them, but not necessarily healthcare decisions for children. When life and death are at stake, serious harm, serious disability, permanent disability, diversity is not something we should be valuing. And second, that advocacy on behalf of diverse points of view is not a virtue in itself. It matters whether what it is one is advocating for is the right thing or the wrong thing. Third, that respect does not require agreement or deference. It doesn't require acting in a way that parents or others want us to act. And I'll try to say, I think Chris probably said this better, but there are ways in which we can respect people and yet still disagree with them. Try to make the point that religious diversity is not some special category, that we can disagree for all sorts of reasons, and the fact that the source of that is religious should not give it any special power. And then I'll just give some examples to try to show how these points get applied. So first, this point that diversity is not a virtue in itself. Definition of diversity is, quote, something that shows a great deal of variety, end quote. And we all value this almost everywhere in life. In nature, we want diversity, we love diversity. In our government, we want diversity. Entertainment, education, the workplace, we all are and should be proponents of diversity. But it's not always a positive value. So we don't need more people like Charlie Manson or Adolf Hitler. Just because they're diverse and have different views than our own, we shouldn't say, well, we welcome this. Diversity in itself is not good. We want good kinds of diversity, but there's some kinds of diversity that are not welcome. The anti-Semitic white supremacists in Charlottesville were not fine people. And the notion that, oh, well, there's all sorts of fine people, and there's people who are white supremacists and people who are not, and we should all respect these equally. I think the majority of the American people found that comment offensive. This all gained prominence when President Nixon nominated a judge named Harold Carswell to the Supreme Court, who was widely deemed to be mediocre at best and not qualified for the Supreme Court, and eventually got turned down by the Senate. But Senator Roman Ruska, in discussing this criticism of Harold Carswell, that he was a mediocre judge, said, quote, well, there are a lot of mediocre judges and people and lawyers, and they're entitled to a little representation too, aren't they, end quote. And I'm glad you're laughing. But he was serious, and you hear that view out there, that the mediocre people, we need mediocre judges. So diversity is not a good in itself. It matters whether it's diversity, some quality that we care about. Respect for diversity in healthcare decisions, I think, should be presumed and deferred to for competent adults. competent adults have, as the Supreme Court said 100 years ago, an absolute right to decide what shall be done with their own bodies. And no matter how bizarre or irrational or crazy or different we think it is, it's for competent adults to decide for themselves. But respect for diversity in healthcare decisions by parents on behalf of their children, I think, should not be presumed to be a value. The standard should be what's in the best interest of the child, not the parent's preferences or interests. I led a child protection team for most of my career in Wisconsin, and I don't have to tell this crowd that there are a million reported cases of suspected child abuse or neglect in this country each year. That's the tip of the iceberg. The actual number is almost certainly 5 to 10 times that. So millions of cases of abuse and neglect should tell us that even though these parents love their children, care for their children, think they're doing the right thing, they simply don't. And we shouldn't just assume that because a parent loves his or her child or has different views that it's entitled to respect or deference. Controversies and disagreements, of course, are common, and the easiest and simplest one that you're all familiar with are a Jehovah's Witness parent who refuses needed transfusion, life-saving transfusion for his or her child. I want to take a minute or two to talk about the one case I had in which a 9-year-old child whose parents were Jehovah's Witnesses died. This was a child who had scoliosis surgery, and post-op, the hemoglobin dropped. It's particularly bloody surgery, to 9, to 8, to 7, to 6. And the pediatric intern on call at midnight called the orthopedic surgeon. The child was on a surgical service with no pediatric attending, but there was a pediatric intern caring for the child, called the orthopedic surgeon, and he said, well, you know, I'm trying to be respectful of these parents' views, and I told them I would try to accommodate their views as much as possible. And I told them we wouldn't give blood unless it was absolutely necessary. And referring back to Doug's case of whether the harm is imminent or not should be important. And when the hemoglobin was 9 or 8, harm wasn't imminent. And when it was 7 or 6, it still wasn't imminent. And so when it got to 6 and then 5, and the intern called me because the child was tachycardic and his blood pressure was falling and the child was anxious. And I said, I don't care what the orthopedic surgeon thinks. You go type and cross blood and give it right now. I'll call him and deal with that. And the intern did, and the child died before he could get back to the floor. So when was it imminent? At 9 or 8 or 7 or 6 or 5? But when we try to accommodate and compromise and respect the parents' views, that's what happens. And not to mention, of course, it's just not comfortable having a hemoglobin of 8, 7, 6, or 5. The child was suffering during that time and feeling anxious and all the symptoms of imminent shock and so on. So accommodation and tolerance are all virtues that we care about, and assuring ourselves that the harm is imminent sounds good. But when we flirt with boundaries of life and death, that's what can happen. That is the risk of a mistake is irreversible. So what does it mean to respect parents and yet to act in a way that obviously doesn't seem respectful, or at least that they disagree with? So dictionary says that respect means, quote, an expression of high or special regard, end quote, or to show regard or consideration for. And I think we can all rally around that, but acknowledging that respect does not mean agreement or deference, and it refers to an attitude and not to whatever actions we take. So we can respect someone's opinion or the other people without agreeing with them. So again, as somebody who was involved with the care of thousands of abusive parents over the years, child abuse is usually parents, obviously, sometimes others. I always felt tremendous empathy towards these individuals. I was familiar with all the antecedents of child abuse and neglect and why parents caught up in these situations sometimes act in the way they do. So I didn't have any trouble respecting them and caring about them and feeling empathic towards them. But that didn't mean that I had to act in a way that deferred to the way they would have wanted us to act. Many examples of this in ordinary life. Boxers try to kill each other as best they can within the rules. And then when it's all done, they embrace each other and have enormous respect for each other. They understand what the other person's just gone through, even though they just tried to kill him. There's a great exchange between the great basketball players, Will Chamberlain and Bill Russell, who were fierce opponents over a decade or more, and best of friends, but just really vicious antagonists on the court. And at one point when Chamberlain had just dunked on Russell and they were trotting down the other end of the court, and Chamberlain said to Russell, "You know, you're the only person on this planet who understands how good I am." And it was true. They had just enormous respect for each other, but you couldn't tell during the game. So respect involves an attitude and not a position. Our present president has extreme contempt for the press. I think all presidents dislike the press. I think all presidents actually do see the press as something of an enemy. But prior to our present president, they had respect for the press and were able to say, yeah, I disagree with you and I'm really annoyed at the way you're behaving, but I understand why you're there and why it's important. Some of this is, Chris Feutner referred to a variation of this, but I've always found it helpful to organize my thinking around this ideal observer theory put forth by Roderick Firth half a century ago. An ideal ethical observer is someone who has these 5 characteristics. One, omniscient, which doesn't mean knowing everything, but have access to all the readily available facts. And 2, omnipercipient, and this is the one Chris referred to be able to vividly imagine the perspectives of all those who are involved, to put yourself in the other person's shoes. An ideal observer is disinterested, has no vested interest in the outcome, dispassionate, not overwhelmed with emotions when difficult decisions have to be made, and is consistent. Similar cases are decided similarly. But it's this omnipercipience that I think, like all the other qualities we should all strive for, to vividly imagine what it's like to be a parent in this situation, having no power, in which we're threatening the power of the state. To put ourselves in that person's shoes, it doesn't mean we should act differently, but we can at least try to understand what he or she is going through. This came up when embryonic stem cells were on the verge of being invented at the University of Wisconsin by Jamie Thompson. And Dr. Thompson came to the ethics committee 5 years before I should say the IRB, before he published his first paper. He fully anticipated the firestorm that this technology was going to create and the concerns that it was going to create worldwide. And he wanted to get it right. He was very clear. He didn't just want to know what the arguments were for fending off his critics. He wanted to do the right thing. And he asked us to take over and write guidelines as to how he should do this research and how he should deal with the consequences of it. And we formed the IRB did not have jurisdiction over embryos by federal rules, so we had to form a separate campus-wide committee, which I had the privilege of chairing. And we spent several years developing guidelines that eventually became international guidelines for stem cell research. And we concluded, as everybody knows, that it was okay to destroy, we thought it was morally all right to destroy human embryos, but thought they should still be treated with respect, that they were not like fibroblasts or other human tissues, that there was something special about human embryos, not so special that they couldn't be destroyed, but not also so trivial that they could be treated like any other human laboratory tissues. So what did that mean to respect? We had to say in the policy, what does it mean to respect human embryos and yet allow them to be killed? And these were some of the things we came up with, that first of all, they should not be used for trivial purposes. So they should not be used for high school biology experiments. That would be disrespectful. That investigators should have very strong credentials. So we created these committees, or suggested that these committees be created, called embryonic stem cell research oversight committees or escrow committees, to review the credentials of investigators, to review the merits of their research, to make sure it wasn't redundant of something we already know, that it should be valid scientific principles. So whereas investigators doing research with fibroblasts, we didn't think they really needed to talk to anybody about what they were doing. So this is just one other example of how you can treat an entity, in this case an embryo, with respect, and you'll still say it's okay to kill it. I want to say something about advocacy and diversity. So advocacy means public support for a particular cause or policy, end quote. And I've always been uneasy about the agenda in our residency program, which I headed for 20 years, and it's now been headed by other very capable people, that one of the major themes of the residency is advocacy, that the residents should have some advocacy project. And it just seems to me that advocacy, like diversity, is not a virtue in itself, unrelated to the merit of the cause or the means that you're using to further that cause. That we shouldn't be fans of advocacy. We should figure out what it is we should be advocating for. So Hitler was a tremendous advocate for some of the German people. David Duke is a terrific advocate for some white people. That doesn't bring any value to what they're doing just because they're advocates and even very effective advocates. We should care about what it is people are advocating for. And advocacy, the term is too easily used also as a cover for self-interest. So the border issue that Doug referred to, advocacy for an immigration or a trade policy on either side, Democrat or Republican, people can clothe this in terms of advocacy for the children at the border or for those who think we are suffering from letting too many of them in. So we have to be careful about not using advocacy as a cover-up for some other political or other self-interest. So parents who disagree with physicians about healthcare decisions for their children, including flagrantly abusive decisions, are, in my experience, usually sincere and obviously powerful advocates for their children, but that's not the point. The point is not whether they're good people or good advocates. The issue is whether the decision that they're advocating for is the right one. Here's an example of advocacy gone awry, in this case advocacy for people with disabilities. Who can be against that? So this involved a child whose care I was involved with, a 13-year-old child with a severe degenerative brain disorder, profound cognitive impairment, severe suffering, self-mutilation, physically attacking his providers, including his parents, in which the burdens of life seemed to greatly exceed the benefits, according to his loving parents. And they asked us to not just make him DNR, but to stop feeding him. He was fed by a feeding tube. And there was agreement that this was the right decision, that it was in the child's interest, and he was admitted to hospice, where before the stopping food and water issue could be confronted, the day after he was admitted, he aspirated, had pneumonia, which was treated with comfort care, not antibiotics, and died in hospice. And the parents were sad but relieved, and everybody that I know thought it was the right decision. An advocacy group called Disability Rights Wisconsin, a federally designated advocacy group mandated under the Americans with Disabilities Act, which requires every state to have an advocacy organization. The state of Washington has one with the same initials, DRW. They sued me and the hospital and all the care providers and the parents for violating this child's rights as a disabled person. This lawsuit went on for 6 years. It was obviously offensive to the parents. It caused a tremendous amount of acrimony within our hospital, disagreement between and among lawyers and doctors and others. One of the bases of the suits, there were 4 legal grounds on which they sued. One of them was a Wisconsin appellate court decision called Montalvo versus Borovec, the Montalvo case. The Montalvo case involved a premature infant, 23 and a half weeks, whose parents had asked that he not be resuscitated. He was, over their objection, he survived with disabilities, and they sued. They lost at the trial level. Their court case was dismissed, and they appealed to an intermediate appellate court. And the intermediate appellate court, in amazingly clear, simple 6th grade language, said the doctors did the right things by resuscitating this child over the parents' objection because, quote, in Wisconsin, in the absence of a persistent vegetative state, which this child was not in, the right of a parent to withhold life-sustaining medical treatment from a child does not exist, end quote, period. You can never withhold or withdraw any kind of life-sustaining treatment from a child in Wisconsin. Resuscitation, transfusion, bone marrow transplant, dialysis, you name it. So there's no reason to ask for consent for anything because the parents have no legal basis for saying no. It's an extreme position, far out of the American mainstream. This is based on a sense of advocacy for children, particularly children with disabilities. But what it is obviously advocacy gone haywire, which is to deny children with disabilities or potential disabilities what the rest of us are entitled to, which are decisions at the end of life that seem to be in their interest, even when stopping treatment is that decision. Alicia Willett, who's a lawyer, former dean of the Albany Law School, and a fierce advocate for disability rights, in writing about this and cases like this, said, quote, "The message from the disability rights community in the debate over end-of-life decision-making is simple and compelling. The disabled are better off alive than dead, period, always." That is, she strenuously disagrees with this sense of advocacy that we should always be saving the life of children with disabilities or prolonging their lives. So advocacy on behalf of a diverse population, including those with disabilities, is not a virtue in itself. Finally, I just want to suggest to remind everybody that religious claims should not have any special status. We do have a First Amendment that prohibits the state from interfering with the free exercise of religion and prohibits the state from establishing religion. But that First Amendment right has never been interpreted to allow parents to do what would otherwise be considered abuse or neglect of children. That is, there are limits to religious liberty. And in the case of Prince versus Massachusetts, the court said that the right to practice religion freely does not include the right to expose the child to even communicable disease or to ill health or death. Parents may be free to become martyrs themselves, but it does not follow that they are free in identical circumstances to make martyrs of their children before they have reached the age of full and legal discretion when they can make that choice for themselves, end quote. A child is not born with a religion. If you're a Jehovah's Witness, that doesn't make your child a Jehovah's Witness. You can try to make him or her into a Jehovah's Witness, and he may very well decide to choose that when he or she comes of age, but he's not born that way. And when he's 9, he or she is 9-year-old, he doesn't have that. Despite that Supreme Court decision, we have problems like this. The Christian Scientists who have a special exemption, and now it's down to 38 states, it was 45 at one point, for what would otherwise be child abuse or neglect if done by others. This was due to federal regulations promulgated by President Nixon. When the Congress passed the CAPTA law, the Child Abuse Prevention and Treatment Act, the regulations included a specific requirement that states, to get federal funds, had to have an exemption for Christian Science and other forms of faith healing. Why was that? Because Nixon's chief of staff, Bud Haldeman, was a Christian Scientist, his associate chief of staff, John Ehrlichman, and the next guy in line, Eagle Crow. All 3 guys were Christian Scientists. And they convinced Nixon to put this in there, and he was happy to accommodate them. So for 40 plus years, we've been living in a country in which the majority of states grant Christian Scientists legal authority to do what would be considered abuse or neglect if done by anybody else, just because they happen to have this religious belief. How weird is that? If we had a Jewish president, would it be okay if he or she passed a regulation that said Jews can abuse or neglect their children, or a Catholic president giving Catholics? It's obviously unconstitutional. It's just never been brought to the Supreme Court. So we've been having this state-by-state fight due to the remarkable work of a woman named Rita Swan, herself a Christian Scientist, trying to get rid of these special exemptions. But hundreds of children have died because of it, including Kara Newman, an 11-year-old child in Wisconsin, perfectly lovely, healthy child, who over a 2-week period started urinating a lot, became progressively tired, exhausted, dehydrated, comatose, and was near death. Her neighbors begged with the parents to go see a doctor. A cousin living in California, hearing about this on the phone, called Child Protective Services in Wisconsin to do something about it. The police finally went out to the house, but it was too late. The parents were prosecuted and found guilty of negligent homicide. That's a pretty harsh way to treat parents who have a sincere belief. It doesn't seem very tolerant or compassionate. Ideally, we would like not to get to that point. And when parents like Jehovah's Witnesses bring their children in and then argue with us over transfusions, we can win. We can go to court, which literally every time will authorize a transfusion. But Christian Scientists typically and other faith healers don't bring their children in until they're dead. And so there's no way to prevent these calamities other than using the criminal law as a way of deterrence to discourage other parents from doing this. So should we respect the Newman family, the parents? I think so. I mean, I have no problem seeing them. I have no disagreement that they were loving, caring parents and thought they were doing what was best. But respect, it doesn't mean acting in a way that they wanted us to act. So communication, again, is different from decision-making, and Chris talked about this more eloquently than I could. So I think there's no excuse for not showing empathy and respect and civility in all cases. I try to always teach our residents to make I statements, not you statements. I'm not talking about you, I'm talking about me. I'm sorry, I feel terrible. I have this problem that I have this legal responsibility towards your child. There's laws that govern my behavior. I feel terrible about this, but I have to do it. One of the errors I see in my own colleagues is in these so-called futility cases in which we think it's in the child's interest to die, and in which the parents, for religious or other reasons, disagrees and is insisting on aggressive care that seems abusive and inflicting suffering on the child. One of the errors to me in the communication of these decisions is this phony offer of that, well, it's your decision. You get to decide whether Junior lives or dies. I'm talking about cases in which there is no plausible prospect for survival, and in which the parents insist on aggressive treatment for religious or other reasons. This, to me, seems inhumane to put parents in the position of being the executioner for their children. Two, it's a false delegation of authority, as if we just do what parents say. We're just the technicians, and whatever they tell us to do, we'll do. All decisions have to be collaborative. The physician obviously can't just be a technician. And it's a deviation from the directive counseling that is standard everywhere in medicine, except in these end-of-life decisions. When we see a child with otitis media, we don't say, well, you know, it's up to you. We got the antibiotics, and then we got the watchful waiting, and you tell us what you want to do. We don't do that. In cases where it's truly gray, we may say there are alternatives here to talk about, but when it's very clear what we think is in the child's interest, we say that, and we advise parents what course to take and try to get them to agree. The famous Ashley X case, known to virtually everybody in this room, a 6-year-old child with profound cognitive impairment, precocious puberty, growth spurt, whose parents wanted very much to keep her at home and requested growth attenuation therapy, limited high-dose estrogen to facilitate home care to keep her short. That case was complicated by a hysterectomy and breast bud removal, but just looking at the growth attenuation was controversial enough. It produced a furious international reaction with threats to Doug Diekema's license, legal action against the Seattle Children's Hospital. In an article Doug and I wrote, we were able to identify 25 claims by critics of the Ashley decision. And just one of those was that this was discrimination based on handicap and disability, that it wasn't respecting the diversity of children in our society, including children with profound brain damage. And that critics, their view could be summarized by the statement, you never would do this to a normal child. To which Doug and I responded, right, well, we wouldn't do brain surgery on a normal child either, or a tendon release on a normal child, because there would be no benefit. There'd be no prospect of improving their quality of life. But the extreme disability rights groups claim that children should be just accepted as they are, and we should never intervene to change their bodies, which would, of course, preclude treatment of any congenital malformation, whether it's congenital heart disease or scoliosis or strabismus. Of course, doctors should discriminate in taking care of children with disabilities, as they should with all patients. There's good discrimination and bad discrimination, and we're paid to discriminate based on what we think is in the interests of a child. So respect for diversity, in my view, is unwarranted, as others have said, when it's inappropriate, when it will result in serious harm for the child. And for sure, there are great cases in which it's unclear how severe the harm will be or how likely it is. But I'm uneasy with this criteria of imminent that Doug referred to. And I just gave one example, but there are other cases in which we let children suffer, waiting to see if the harm is really going to occur. And it seems to me we're deviating from our duty to remember Dr. Schick's injunction about who our patient is. So to sum up, again, the American Academy of Pediatrics' position that pediatricians should respect families and their religious or spiritual beliefs is something I think we can all subscribe to. If respect means an attitude and a way of communicating, and yet the AAP correctly said that pediatricians should call the cops when this disagreement is going to result in serious harm, and that these are not incompatible, to be respectful to parents with these different views. But respect does not mean acting in a way that jeopardizes the interests of the child. Thank you.